Today's podcast is going to be in English just because of my special guest doesn't speak Arabic. I'm with Peal Wasif, a physiotherapist. She's one of the first Bahrainis to be licensed as a specialist physiotherapist by NHRA. She has her master's degrees in advanced neuromusculoskeletal physiotherapy and specialized in musculoskeletal and women health conditions. We will be talking about the most common pains and aches women get and during and post-pregnancy. Why strength training is important to get rid of these aches, and also we'll be discussing in details about the pelvic floor and its functionalities. So glad to have you here.
Thank you for having me, Mona. Thank you so much. It's a pleasure to be here. You have an amazing gym. It's absolutely stunning.
Thank you.
Thank you for letting me.
Finally, you get to see
I know.
what I do because I come to you all the time.
I have a great idea what you do, but no, it's great to be here and see actually how the gym is opening to others, and you know what you actually do behind the scenes when the patients come to me. So yeah.
So let's get in. I said we'll be talking about the most common pains women come to you for. So let's say, is it mostly women that come to you?
So yes, the majority of patients that I see are women, but I do see a lot of male patients as well. And they are of different age groups. So that's a very interesting question because it varies from which age group you're talking about. The most common.
Let's say most common.
Most common all over the world, not just in Bahrain, low back pain.
Low back and
shoulder pain or neck pain. That would be the most common complaint that ladies usually come with. And in terms of upper body, that would be either shoulder pain, neck pain, depending on their job profile, what they're doing, how they're doing, all these things affect. Musculoskeletal, which you just said, is basically the muscle structure. So it could range absolutely anything why they might complain. And just being specific to women, one of the main reasons also that they complain is pelvic pain. So, you know, that's general, you know, that they come and they're not really very well educated about it, and they might just say, no, it's, you know, it's my hip. Yes, the hip is associated, but you know, it could be, you know, you have to narrow it down and make them understand or educate them, you know, why or how or what's the reason this is actually happening. So yeah, these are the mainly the reasons I see women. And recently, actually in the past 2 years, ladies are very well aware how they need to take care of themselves when they're pregnant and even after pregnancy.
Yeah, I feel it's much out there now than before.
So I'm saying, like, when I'm talking about before, I'm talking about like 6 years when I just came back from the UK, and I'm trying to have a conversation with youngsters, like young ladies, and I'm telling them, okay, you know, you need to strengthen your pelvic floor muscles, or, you know, you're pregnant, you need to, you know, start a little bit of kegels, and they'll be like, for what?
What is it good for?
Why?
Yeah, so we'll get into details exactly what does the pelvic floor do and what are the importance of it.
Yeah.
So let's get back into, let's say you said the most common thing is back pain.
Okay. Yeah.
So what are like the reasons behind usually back pain?
Okay.
So, and is it, let's say, only associated to weak core, weak glutes?
Okay.
And what does a physiotherapist does when someone comes with low back pain?
Okay. So when anyone walks through my door and they say low back pain, the first thing they say, I have a disc. And I tell them, if I do an MRI today, I will find 10 of them. So they associate that with the problem of them having low back pain, but it is actually quite vast. You know, the back is a structure that is connected to different parts of your body as well. So you could have back pain just because your muscles are aching. You could have back pain just because of your posture. You could have back pain because you just had a workout. You probably didn't, you know, warm up or stretch. You know, there are many reasons, and that's why it's changed from low back pain to non-specific low back pain, which is not. It's a huge term that eliminates, you know, problems that you might have with your disc or neurological problems or anything associated with the actual serious problems. You know, we need to stop addressing low back pain as a serious problem, because this can happen to anybody. It's normal. So when someone comes to me from a gym and they say, I have low back pain, I did something wrong in the gym. No, you could absolutely do everything right by the book and you'd get back pain.
Yeah. It's just, if someone is strong, healthy and good and walks for like hours, she will get low back pain, or like, let's say, any kind of pain, because you're just doing it for a long time, and it's only normal for someone to come and
your muscles are sore. You didn't stretch properly. You have a lot of lactic acid in your body, so all this soreness contributes to pain itself. So there is no specific reason, and I want everyone to know specific reason of low back pain. It's not that you did something wrong or you are doing something wrong currently. It could be associated with anything, But having said that, yes, there is a right and a wrong way to strengthen.
Yeah. Okay, let's say if someone doesn't go to the gym, doesn't work out, and comes to you with low back pain, and as a physiotherapist, what would you recommend that person? So if, let's say, she has or he has very weak core and doesn't know how to brace well, or doesn't know how to use those muscles. Let's say that's not weak, it's just they don't know how to use those muscles. So it's usually, for my clients, I see they don't have like weak core, or let's say a lot of weakness, but it's just they don't know how to actually properly use that core and brace well enough.
That's excellently said, because you can't really say weak. Okay, that's exactly what you said, and you said it perfectly. Someone who comes in and is not very physically active, doesn't go to the gym, first and foremost, we need to understand what the person does in his daily life. Is he sitting on the desk for 8 hours or more and he's not moving? So he's in a position that he is not very quite mobile. So in that case, you would want to introduce some sort of physical activity in his life. But I wouldn't suggest him to go full on strength training. I'd say start off with cardio. There's so much more that you can do with that, not necessarily weight training itself. Understand your core, as you just said. You need to know how to activate your muscles,
One thing I noticed, if someone doesn't have a background of how to actually activate core, so it's a lot of people saying, get your tummy in, or that. So it just the technique of the bracing itself. It's how the diaphragmatic breathing. Exactly. So brilliant. Sometimes I can tell if someone knows how to activate by their breath, or how they breathe during the workout itself. So the bracing has a lot of impact on how it will stabilize the spine, the obliques, how it will protect the spine, the QL, and a lot of muscles around it.
Definitely, because and I hear a lot of patients saying, you know what, I do squeeze my tummy, and I bend over, and I make sure my spine is straight when I'm lifting up everything. No, it is not rocket science. We are human beings. We have to be flexible in what we do. But yes, the alignment does make a difference. You need to understand, if I'm going to be lifting this up, I need to be able to have a strong core, and how I engage not only my core, because my core, I need to activate other muscles as well. Like you said, obliques. How I'm going to lift up something, activation of glutes. It's all associated. It's not necessary just suck in your tummy and just lift that up. And breathing is so important, because I'm very sure you see the clients
very underestimated.
They're like, breathing. Okay, I'm going to lift this up,
holding the breath. And it's okay if someone doesn't know. So comes the part that it's either your job or my job to teach the patient or the client to actually how to do that kind of breathing, the diaphragmatic breathing, not just the shallow breath, let's say it.
And I think it's a great association that a physiotherapist needs to be backed up by someone who knows the anatomy or the physiology behind. So yes, I know what I'm doing. I do treat the pains and aches. I do get what actually is wrong with the patient. And it's good that we have this kind of understanding that we can actually have a conversation like, okay, you know what? For example, he's not activating his glutes when he's doing a squat, or, he's completely dependent on his upper back when he's bending over. He needs to distribute the weight. I can tell them, this is why you have the pain. I can give them, I can initiate the therapy, but I can't stay with the patient throughout his life.
Exactly. So
so this is where you need to have a conversation. And that's why I love having conversations with you, because I can tell you, okay, Mona, this is what's happening. The patient is pain-free right now, and his flexibility has increased. Can you please work on this? Because just because I've corrected it, that doesn't mean it's not going to come back.
Yes. Okay, let's get back into something for whoever is listening, and for us to understand, what is a physiotherapist?
Okay.
Like, or let's say, what is physiotherapy?
Okay.
So what is your job to do?
Okay.
So is it just releasing the muscles, or just give us a brief or define what is physiotherapy?
Okay.
Just say it in a very simplified way, like just for people.
In my own words, everyone asks me, what do I do if I'm just a masseuse? But I am not just a masseuse.
No, you're not.
No, I'm not just a masseuse. A physiotherapist is someone who understands the muscles, the bones, the joints, the nerves, the anatomy properly. We are not just associated with just bones or muscles. We need to understand the structure beneath it as well. Mm-hmm. We need to understand what is associated with that pain. So my job, or our job, is to first identify, like I just said, low back pain is a vast term, is to identify why the patient has low back pain. Yeah. What are the structures involved? Is it associated with a nerve involvement? Is it associated with
deep
fascia? Yeah, it is. So it is not just, okay, patient walks in, he has low back pain, I'm just going to release him, which, don't get me wrong, it does help. I do it also.
It's not the root cause of it.
But it is understanding where the pain is coming from, what is the associated problems with the pain, and then making patient education is huge.
Yeah.
I can sit down and I can just treat the patient, say, okay, you're fine. And the patient knows that he's fine. But if he doesn't understand what's happening, so it'll come back again. So educating the patient what actually is the problem. Mm-hmm. And then treatment, or restoring function, restoring flexibility, making sure that the patient is mobile, active, so that reoccurrence doesn't happen, getting back to daily activities. This all is a whole circle, So from scratch, identifying, treatment, diagnosis, and then making education of the patient, and then making them go back to what they're doing is what physiotherapy is about. And in terms of treatment, it could be manual release. It could be dry needling. It could be dry cupping. It could be hijama. It could be fascia release. It could be manipulation, mobilization. There are so many things.
So are you saying usually pain is always related to tightness?
No.
No?
No. And this is quite...
Because you said release and needling. So needling, the job is to release the muscles, or let's say like manual release.
Manual release, yes. Okay. So
I'm just, for people to understand, for me to understand more.
Okay. Pain is a huge term. Okay. Some people say pain is related to tightness, stiffness, weakness, whatever it might be. But I will get a patient in my clinic who has low back pain and is not tight, is not stiff. All these terminologies don't apply to it. But he only gets pain when he's in his work. But when he goes for vacation, he's absolutely fine.
So it's stress and vent.
So
it's a different.
It's a different. So we need. This is the term where it comes in: biopsychosocial. You need to understand basically the anatomy of what is actually happening. The psychology behind it, and how do you integrate, the social aspect into it. So there are 3 different ways you have to treat, and why the patient is getting pain.
Yeah. I was listening to this podcast regarding how the people, the women or men that have fibromyalgia, how it's related to the
central sensitization. That's basically the term. So over a period of time, fibromyalgia comes under also it's like chronic pain syndrome.
Yeah.
Okay. Chronic pain syndrome is basically someone who has pain over a period of time, that their body starts, the alarm system in their body is always on. Mm-hmm. So it's not associated with, I lifted something, I will get pain. So, it's just say, you will get pain. You don't have to do.
So in this case, you relieve like the patient like let's say just for instant relief, but it's not. It's a bigger picture. It's related to So that's not your job to do. Which is, what do they call these?
So this is interesting. So when you said, very well pronounced, neuromusculoskeletal. Okay.
Thank you. So, it took me 2 days to it.
Neuromusculoskeletal, basically, people think it's neurology, but actually my qualification is the pain management aspect. That's the neuro part of my degree. It's understanding where the pain is, whether it's associated to pain, whether it's associated to muscle or even not. Okay. So with the chronic or persistent patients, I have actually done CBT, which is cognitive behavior therapy. So physios with correct qualification can also do that. Now, back in the UK, I had a whole clinic just assigned to cognitive behavior therapy. So the patient comes in who has persistent pain. There is no point of me explaining glutes, back, muscle. No, he only understands pain. So I have to break it down to him, let him know where his pain is coming from, and then slowly and gradually, which takes, I'm not even kidding you, months for them to understand and associate, what's actually happening. And that's cognitive behavior therapy. It's basically a therapy that makes them feel a little bit better about themselves. Okay, in that sense, and then introduce daily activity, then introduce a routine. Okay. You're not going to jump with this patient.
It's a process.
It's a process. And when you say central sensitization, that basically is, as I said, an alarm system. So this patient walks in and there are signs and signals that you will know. I might touch the patient just like this, and this entire area becomes red. So it's how they perceive pain, how they react to pain. Yes, physios with the correct training or the correct degree can address those conditions, but it's a lot of training. So physio in its term is huge. Okay, it is. But again, we need to know where we draw the line. So I'm not going to overstep anybody and say, no, you know what, he said it's wrong, blah, blah. Everyone has their own opinions. Exactly. Yeah, I have my own opinion. They have their own opinion. As long as I have the autonomy to do what I'm doing or to help, which is the bottom line, So,
interesting.
Yes.
Very nice to...
You finally know what neuromusculoskeletal is. Yeah.
Okay. I just want to, because I do get this a lot with my clients. Yeah. So there's a lot of people that have, like, let's say, upper back pain. Mm-hmm. And so it's always sometimes related to the scapula.
Yes.
And like, let's say, I don't know if you like this term, or like a deactivation they don't know how to activate, or it's always not there. So what is the reason that usually, even if someone is strong enough or work out, and why is this area always very hard for people to control?
Okay. Because there are a bulk of muscles that are more dominant than that usually. Mm-hmm. So you're talking about smaller muscle groups. So if I'm saying, for example, you said shoulder pain. Okay, now in majority of the people, you'll see that their traps is the most prominent muscle that they're working. So whenever they're lifting up things, you'll see that they have.
Even when you're stressed.
You're stressed, that's the main reason, which overrides other muscles. Okay, so you need to understand that they work as a family. Mm-hmm. Okay, and if I have to break it down, is the traps is taking over the role of the entire family. And it's very difficult for them to understand, okay, I need to activate my rotator cuff muscles because that also helps me in my scapular movements, And when you say rotator cuff muscles, it's a bulk, it's like a cuff around the shoulder joint. So, and you might start with them and say, no, this is it. Activate it, but they will not understand how to activate it, That's where feedback mechanism comes in. You need to pinpoint, you need to tell them, touch. This is my finger. Can you please try to push? Mind-muscle connection. Start isometric exercises, which most trainers do wrong, where they say, okay, the rotator cuff muscle is not working. Let's do push-ups. Let's start up with these high intensity exercises. But if you do not connect the movement to the brain, if you do not connect the activation on a personal level, it's not going to work. Yeah. So if you drop it down to as simple as possible and tell them, look, this is what I'm touching, This is what I want to activate. I'm going to place my hands over here. Try to bring your scapular blades inwards and do the movement. Trust me, after 10 reps, they'll understand,
Yeah. It might be boring for people. That's why.
It's extremely boring.
Yeah, that's the thing. So that's why people tend not to do it. And I wouldn't call anyone. I don't know anyone personally, but I do know that some trainers would not want the client to get bored. So they just want to give them, do this, do that, and not give them that boring exercise.
Don't get me wrong, because when the client walks out, he wants to feel sore because he knows that,
Exactly. Or he wants to be like sweaty and like feel like my heart rate is pounding.
Exactly.
And sometimes it's not good for all cases because you need to address a few things if you want for longevity, for you to stay in this field and healthy lifestyle.
Exactly.
You know?
And even overactivated, like the traps, they're associated with the sternocleidomastoid, the muscles over here. People complain that I have headache, a constant head, because these muscles are so overactive that the other muscles are not taking over. Yeah. So if you can release or if you can activate the other muscles, it will make such a huge life change, It's not about bulking up all the time. It's about getting the form right. And when your client sees that, you know what? It's so much easier to lift this up because I'm actually
using it in the correct way.
And I'm not straining and I'm not doing this and,
Yeah. And as a physiotherapist, do you think supplements has to do, or like, let's say deficiencies in few, like, let's say vitamins has to do a lot with the tightness and pain that people have?
This is very debatable.
Are there like studies on?
There are huge studies on, even the joint medications that people use, and they basically have given placebo and they say it does not really help. It doesn't make a difference. But to a certain level, when there is a deficiency, yes, an additional supplement will help.
What is the most thing that, like, let's say, is it vitamin D deficiency that would cause spasms and like let's say tightness in muscles and dehydration, or I don't know, like what more studies have?
So surprising enough, there is a study that shows that vitamin D deficiency is the most in the Gulf when we have sun everywhere, because we're actually hiding from it. But when a patient walks in and he says, I get this pain in my bone, or it's just a nagging pain, it's an annoying pain, or I constantly feel tired and I'm exhausted and I am fatigued and stuff like. And when you go and do their vitamin D, it's like below normal, or and after 3 months of the supplements or whatever it might be, pills or injections, they actually feel much better.
Yes.
And yes, it is related to the muscles. It is related to the nagging pain that they're talking about. If you're fatigued, whatever it might be, where the deficiency or whatever, you are constantly tired.
Yes.
Because your muscles are holding your entire body, your entire structure. So
dehydration plays a huge role as well.
Huge. It's huge because if you've noticed that most of the triathletes, when they're running, yes, they have to hydrate themselves. But as soon as they stop the race, their muscles are like this. You can actually see it.
Yeah.
You give them an electrolyte and they're fine. So it plays it is quite significant. There are studies that say
but honestly, with my own experience, the way I see someone walks or how tight they are, the first question I asked, how often do you drink water?
Yeah.
And some people could say 3 days I don't drink water. And you can tell, and that's a huge thing. And people don't even look at how the importance of hydration plays a huge role on the aches on your body and the tightness. And tightness could cause that pain. That's the thing.
Exactly.
Or let's say weakness causes that tightness. Tightness causes pain.
Yes,
it's a cycle.
It is.
Goes on.
And sorry, but Coke does not consider as hydrating yours.
Neither coffee.
No, neither coffee.
And tea.
I had like 6 cups of tea, so that's considered as water. No, that is not considered as water. You are sweating throughout the day, whether you're sitting in the AC or not. You are removing the water in your body, so you need to keep hydrating yourself as much as possible. So yes, it makes a huge difference. Yeah.
Okay, so let's get into now pain with pregnancy and post-pregnancy.
Yeah.
So you do deal a lot with.
Yes, so I deal with a lot of pregnant ladies who do come with me Main cause, again, low back pain. So it's not, it's low back pain can happen to anyone, someone young, old, pregnant, whatever it might be. And their main cause is low back pain, for instance, or low back pain with the sharp shooting pain, could be sciatica. Could be sciatica, could be just, nerve irritation, whatever it might be. And it is important for them to understand, and everyone to understand, why does she have complaint of low back pain? Because when you're pregnant, you have an increase of hormones in your body, which actually increase the laxity of your body, which is, your ligaments start stretching out.
Gets like, let's say, relaxed and just
to accommodate the baby.
The hips and
the posture changes.
The pelvis
completely.
gets tilted and like
exactly. So this is not your normal.
Exactly. So would you consider normal for someone pregnant to have, like, let's say, some sort of pressure in their lower back due to the pelvic tilt?
Yes.
Yes, so it's
100%, because the
structure
center of gravity is changed. Because of the tummy accommodating, you go into this lordosis position where there's a lot of pressure on your spine. There's a lot of pressure in your pelvic region, and yes, and not only pressure in your spine, but yes, the muscles do get tight because you're in a position
that's not the usual.
Not the usual. So if someone walks in and they say, I have back pain, is it normal? And do I need to do bed rest? No, you don't need to do bed rest. Yes, address the pain, whatever you might, however you can address the pain. Stay physically active during your pregnancy. We're past the norm where, no, you're pregnant, don't lift anything, don't do anything.
Don't go up the stairs. Don't cross your legs. Of course, it depends on each pregnancy. Maybe they need
once, and so in the rare instance, or in the situations where the pregnancy or conceiving was difficult, or they are having complications in terms of where the placenta is placed, or bleeding, or other conditions where they're ruled out by their gynae, okay, I'm not going to touch you. Okay, but again, if you have to do bed rest, there are simple things you can do. Ankle pump exercises,
which is what do you mean by
ankle pump? So moving your ankles back and forth, like you're going to press the brake of the car. That circulates the blood, that keeps everything.
Because some pregnant women get those spasms in the calves,
yes.
right? And like the second, third trimester.
Yes, and it gets quite severe. So if you're going to have a bed rest, which you are supposed to, but there are certain things that you can do as well. The whole point of bed rest for these type of patients is because their placenta is placed really low. It is more easy for them to go into early labor, or actually in early stages have a miscarriage. So they want to keep gravity away, and that's why they say do bed rest. But you can do stuff on the bed.
Okay.
Pelvic strengthening early on in your pregnancy is so important.
Okay, explain to us what is it. So
pelvic floor. So basically, the pelvic floor is like, you can say, like an umbrella, from beneath your pelvis that holds everything together.
The organs together.
All the organs together. It provides stability not only for your pelvic region but also for your lumbar spine. You need your pelvic floor muscles during sexual intercourse as well. They need to stay healthy. Stability-wise, going to the bathroom, you need your pelvic floor muscles to contract and relax.
Which some people get the incontinence.
Exactly. Okay. They get the incontinence after pregnancy, after they deliver. And a majority of my patients that walk in, they'll be like, okay, I coughed and I kind of, peed myself. Is that normal? Depends when you're talking about it. But no, I'm sorry. It's not normal. But after pregnancy, it's fine to have it, but you have to address it
and make sure it doesn't stay.
It doesn't stay.
What is the period that, let's say, it's considered as normal because you just gave birth?
Okay. Usually postpartum, we give a 6-week rest period for the moms. In the UK, it depends if you had a normal cesarean, if you had normal delivery or cesarean. So you can go back to a physio and get yourself checked up at 4 weeks after you've had a normal delivery. And 6 weeks after cesarean. So that's when you check the pelvic floor muscle. And if a patient tells me, okay, you know what, I can't control my urine, or it's difficult to even pass motion, by the way, that you can't control your motion, that's when you need to start your kegels. And even for people who had cesarean, as soon as you deliver, you can start your Kegels. You're just doing it supine on the bed. So,
but is it that I was reading a lot of studies that some people would say Kegels are like very or like overrated. So there are much more pelvic floor exercises than just Kegels itself. So some people don't even know how to
do Kegels.
So what would you actually give for someone to, if they don't know how to perform Kegel, or how would you explain that to them?
Okay.
You know?
So Kegel is the baby. Basically, we start off with Kegel exercises, especially in the initial stages. You can start your Kegel whenever after postpartum.
Like literally the next day.
The next day, you can start your Kegel. Now, when I see the patients, I said, do you know what Kegel is? They says, yes, I know what Kegel is. Tuck your tummy in and squeeze your glutes.
I feel like the easiest way to explain it is like you will you're gonna hold your pee like in the mid.
Yeah, or you're trying to pull up your pelvic floor muscles upwards. And for me, it's for me, I let them place their hand for them to understand, okay, look, you are squeezing it, which is great, but at the same time, you're squeezing your glutes. It shouldn't be that way. Don't facilitate the squeezing of the glutes as a pelvic floor movement,
Okay.
And you said a very good point. Is it just Kegels, or is it the core, or is it something else? You start off with Kegels, then initiate Kegels with core. Make it more progressive, make it more difficult.
So, and then you connect. I remember when I did my certification.
Yeah.
So it's always related to, it's called the connection breath. So you relate how you breathe, you contract the pelvic floor, release the contraction and the release.
There's a certain amount of,
and then you add in movements. Like let's say bridges.
Single leg
stuff, and you do the contraction.
Relaxation.
Let's go. It just comes.
Because patients will be like, tight, go on. You need to take a break, give yourself a 10-second break, and then start off again. And even some of them think that if I do 20 reps of Kegel, I'll be stronger. No, there is a certain amount of time that you can do Kegels. You don't need to exhaust your pelvic floor muscles. So back to the question, pelvic floor muscles are quite essential in so many different functions, not just they're not just only holding the organs, they're used in stability wise. You need that for actual day-to-day activities, circulation, and all of it play a huge role. And if someone says, I have a pelvic pain or a pelvic problem, you'll ask them, okay, explain to me, where's this pain? They'll be here, because it's connected to everything. So yes, they're not lying.
Exactly. So it is something very important to address.
Very quite important. So it is important for them before pregnancy, to strengthen their pelvic floor muscles. Also
before pregnancy.
During pregnancy. Okay. And their abdominal muscles as well, because obviously the baby is growing, but your rectus abdominis muscle is stretching out.
Yeah.
So it is so normal for ladies to have a separation that we call diastasis recti after pregnancy. They think it's a condition that, oh my God,
they stress about it so much.
Stop stressing about the gap. It's there. It's going to happen to anyone. Someone who's skinny, someone who's overweight, it does not matter. And recently studies have shown that the myth that you're overweight, your baby was huge.
That it depends on the size. So there
is no relation. Yeah. It can happen to absolutely anyone. So that's why if you strengthen your core, it just makes it easier
to get it back
later on, to help you, strengthen your core muscles, your pelvic floor muscles, and just to get back to your day-to-day activities.
So don't stress about it. Because I think the social media makes it such a big deal that, oh my God.
Yes. Too much information is also quite dangerous. So, in general,
which is a normal thing. It's a natural thing to happen to the separation could happen in your body, in your abdominal.
Address it in the correct time, which is what I kind of emphasize on. The time is important because in some ladies, don't get me wrong, within the first day to 8 weeks postpartum, it's going to close straight away.
Yeah.
But for some, it can last 3 months, 6 months, 1 year. Okay, so it depends on.
So I was actually speaking to that day. I had a guest here, so she's a pre and postnatal coach as well with me. So we were discussing this, and I was telling her that I have clients that they never trained.
Yeah.
Or let's say I would give you an example. My sister.
Yeah.
Okay. She never trained in her life. She had 2 babies, and and she has scoliosis.
Okay.
And her separation got like back in like 2 weeks, and she never did any exercises. So I feel like it's genetics. So it depends, or let's say it depends on.
Yeah. It depends on, and actually it has also been said in a couple of papers that if, say, your mom had it or your sister had it, you're more likely to have it. So or if your mom didn't have it,
you wouldn't
have it. But your sister's lucky.
Exactly. That's what I'm saying. So it just,
but that doesn't mean she's not going to strengthen.
Exactly. Doesn't mean that it is strong. I'm just saying
that. So that's why I meant stop focusing on the gap. Just focus on the endpoint. Yeah. What needs to be done, So
sometimes it's also not about the gap. So it's about the stiffness, right?
Yes.
So if someone has, let's say, I think it doesn't even consider as a separation if it's 2 fingers.
2.5, yes. 2.5 fingers, yeah.
So it doesn't consider.
No, it is.
But it's not like
it's not. So this is the thing.
Not a big deal. Let's say if
it's normal to have the separation after pregnancy, but the reason why we're trying to address this problem right now is because when you hit 50, when you hit 60, and you have not done anything about that, it's going to turn into a hernia.
Okay.
So what is a hernia is basically you have your muscles, you have the sheet underneath it, and then you have the abdominal muscles, the organs basically. And when you have the separation, that sheet that is holding it becomes thinner, okay? And over a period of time, moms or ladies, we're picking up things, we're doing things. It's very normal. It's common for it to actually... the abdominal muscles to jut out,
like to bulge out,
and that results in a hernia, and that results in you going for an operation. So that's what we're kind of avoiding. Apart from strengthening, we need to avoid the actual complications. For example, you said incontinence. If you don't strengthen your pelvic floor muscles, you will have incontinence. You'll have it worse when you're getting older. What happens? Incontinence. Then you also have prolapse. Prolapse is when the pelvic floor muscles are weak. All the organs are over here. Weakness, it falls down. And there are grades to it. So when you've reached like a point where, you can't really do anything about it, that's when you have to go for a procedure, an operation. So we're trying to avoid all
those huge things, which I think also there's the pelvic girdle pain as well.
Pelvic girdle pain. Pelvic girdle pain is it's normal for you to have pelvic girdle pain during your pregnancy because, again, as I said, the structures are changing. But if you don't address it while you're pregnant,
it could reach to a very
usually it solves itself. But if you don't address it while you're pregnant, it's a constant pain throughout the woman's life. So pain around the pelvic region, pain around the glutes, pain in the hip joints, pain in the pubic symphysis, which is the joining of the 2 pelvic bones. So why we're talking about women's health, and I'm really happy that you understand, because obviously you have done the pre and postnatal course. It's essential, yes, to have a healthy lifestyle, but also to prevent further complications. There are different stages where you can do the exercises, and you have to be careful of when you're doing the exercises, how you're doing the exercise, and what time frame you're doing the exercises.
Okay. So you said that you worked in the UK for how many years?
I worked for 2 years.
2 years. So did you see a difference into how the patients there are more educated in terms of the pelvic floor and here?
Yes.
Why do you think is that?
Okay, so... And this was also a shock for me as well, because working in the NHS hospitals, which you can say is basically the government hospitals, all the British people, they get free treatment over there.
So like
Salmania. Salmania.
Okay.
When you're pregnant, it's a full follow-up. When you're pregnant, after you're pregnant, and what you do. So as a physiotherapist, I had classes daily with postpartum moms. They come in and I have to educate them about it. They have to do the classes because their government is paying for them. And the physiotherapist actually telling them or educating them when they're coming. It's not just I'm seeing my gynae and that's it. Over here, or even the guidelines are 6 weeks, you have to go to see your gynae. But over there, 6 weeks, you also have to go and see your physiotherapist.
Nice. So we don't have this here.
No.
So I know that obviously you just gave birth.
Yeah,
Okay. Okay. So if you weren't a physiotherapist, would you know about such things from your doctor that there's a separation, or let's say you need to go for a physiotherapist to, let's say, check the health of your pelvic floor? So that's the thing. I know a lot of people that gave birth and the doctor, I know maybe that's not her job, but she should at least recommend that you need to see, let's say, a pelvic floor specialist or a physiotherapist. Therapist. So why is this missing here? Why do you think it's not there? Because I know that they, after after 6 weeks, they check the baby, they check you. And okay, you're good to go and nothing is wrong, all is good. So why is there no guidance into you need to go see it? So a physiotherapy is not when you have that pain.
Yeah.
No,
it's not.
Yes. That's the perception we have, that you go to see a physiotherapist when you're in pain.
Yeah.
But the truth is you need to go to
actually
see the health of your pelvis or anything.
Pelvic floor, So yes, I am a mom, and yes, I had a very good gynecologist, and it was great for me to keep on having these conversations with her. But before I met my gynecologist, I have gone to several of them. And unfortunately, there is a lack of communication between the gynecologist and the patient. Yes, it is essential to get your pelvic floor muscles or to check for your diastasis recti and all this, but they do not educate them.
Yeah, why is that? Is that their job?
In the UK, yes.
In Bahrain?
It should be. I'm sorry.
Because I need to understand, because I need to see, is this out of their practice or not?
No, I mean...
because why am I, as a personal trainer, I do check all postpartum moms to check if they have a separation. And it's a very simple thing to do.
And don't get me wrong, there are gynaes who do that.
Yes,
and they say,
know.
Okay, you have a separation, maybe you should see. There are, but there are a very handful of them. Maybe I think, again, it's to do with the cultural difference as well over here. So if you were to talk about pelvic floor muscles, now we're having a podcast, but we're very openly talking about so many things, pelvic floor muscles. Yes, it's talked about it's weak muscle stability, blah, blah, blah. But I just also mentioned it's also involved in the sexual intercourse.
And it's very taboo to talk about such thing, because it is, one thing, it is not normal for you to have painful sexual intercourse after, like, let's say 8 weeks or after pregnancy. Or let's say how many weeks?
So again, your body is healing, so you can, from like 6, 7, 8 weeks. It is a little bit difficult for some, but for some it's absolutely normal. Now there are underlying causes while apart from you delivering a baby. Before that, why you actually have pain? It could be endometriosis. It could be so many.
Now you're going into like things I want to talk about. So about the people who have endometriosis, and I want to. Yeah. So
there are so many reasons. But again, like you said, it's taboo. So it's not like the doctor doesn't know or she's not doing a great job. Gynecologists, trust me, they're doing a brilliant job by being there for everyone. It's just
not
who
in
you're
our
talking
culture,
to, not our culture,
to talk about such things.
When I have a conversation with my patient or a mom that walks in, I ask her straight away. And this is what I have learned with my practice back in the UK, because before going to the UK, I did train and I did work in Bahrain. And so when I sat in front of a patient, again, a mom, and I'm asking, okay, do you have pelvic floor pain? Difficulty when you're with sexual, and my instructor is like, what? Say it out loud. Why? She can't hear you. Why? I'm like, no, I cannot ask these questions. I'm shy to ask these questions. But I
think this is because how we were raised, and because it is not something which I find it is good that it is.
I know.
Exactly. It is. Because this is not something in our culture to talk about such thing, which is, I understand.
Yeah.
But when it is your job.
And it's concerning you.
Yes.
And it's affecting their life. Yes. You don't know how difficult it is for a woman to actually be going through something like this. She's depressed. She's anxious. She's thinking about so many other things, This affects everyone. And this is where the psychological aspect comes into it. Yes, I'm having this problem, but me constantly thinking about it or not being able to talk to somebody makes it even worse, you know. Yes, the doctors can, they know that the problem is there and they can talk about it. But again, I think it's because they're scared, they're walking on eggshells, that they feel like, maybe if I tell her she has a separation, she'll feel like I did something wrong, she did something wrong. I don't want her to be worried. Or if I tell her pelvic floor muscles are weak, she might think she can't conceive again, you know. So I think maybe there are so many other barriers to it. And even in the hospitals, because I've done my homework, a lot of hospitals have this package, post-natal package. And I've looked into it. What they mean by postnatal package is follow up with your gynae. That's it. Or antenatal package, follow up with your gynae, ultrasound, scans, this, not with, okay, go meet your physiotherapist, see why you're having this pain, or talk about, you know, abdominal muscles or what I need to be doing, when I need to be doing. And because we need to start talking about it. We need to start taking care of ourselves. You know, in the end of the day, we're not just employees, we're moms, we're sisters, you know, we multitask like there is no tomorrow, you know, so we need to take care of our health.
Yeah. Okay. So why, or let's say, how do you treat patients that are pregnant that have that, let's say you mentioned earlier, that sciatic nerve pain, or how would you differentiate if it's actually a sciatica? Or it's, like you said, just a
nerve irritation.
Nerve irritation.
So there are a couple of special tests that you could do to actually, again, the special tests depend on the specificity. This is a medical jargon, but based on the research, if it's actually specific to the condition or sensitive to the condition. So you can do those things to actually see if it is actually sciatica or an actual nerve compression, nerve involvement coming from the spine. But again, having said that, even if it's a nerve involvement, nerve compression, you have to see so many other things: muscle power, reflexes, sensations. You know, if these all things are intact, you can still work with the patient to get their muscles stronger. Now, with moms that come to me and they say, okay, I have the sharp shooting pain and it's hurting me, and, you know, I can't move, it's my nerve, blah, blah, blah. Let's not forget, apart from you being pregnant, you have a lot of water retention. Okay, our muscles and our nerves are covered with so many things. It's there's a certain space that it can accommodate. But apart from that, if you add the water retention into it, they're just fighting with one another. So, and it also could be that, you know, how she's sitting at work that has caused a little bit of a you know, muscle tightness or whatever, muscle stiffness that you're talking about. And, you know, she's cross, you know, like
just, it's just
certain things, you know, that's why I said irritation. You know. So if a mom comes to me and say she has low back pain with sciatica or nerve irritation, first and foremost, I would advise her, how is she sitting? What's her job profile like? Now, we're sitting, we can be sitting pelvic tilted, anterior tilted, whatever it might be. But for them, they have to sit constantly like this, you know. So they're sitting constantly, putting pressure on their gluteal muscles. So postural correction, okay, which has helped moms as well. I asked them to get a small cushion, so that's a little bit, you know, padded for them, just to lift off the pressure from the irritation. I do a little bit of manual therapy, not just to the glutes, but around the entire pelvic region, the fascia as well. I release that.
The flossing helps as well?
Yes, definitely.
I have a pregnant
definitely.
client. The same day the pain has gone.
Yes.
If she's watching, she knows who she is. And and one day she's like, I went to the doctor. They told me it's a sciatic nerve and like, just do the flossing. And I taught her the flossing and she's like, I can't believe it's gone. I'm like, it's just, I was explaining to her, what is it exactly? And how it's a very small, tiny muscle that's triggering that nerve. So it's shooting all over. And we just did like few bridges, stuff that would help, and just to get more blood flow in that area. And
so flossing, what you just did was pain management. Okay, so exactly. First, start off with pain management. I'm not going to go and give her a million exercises, which I don't do in my first session either.
Yeah.
I address the pain, whatever it might be, even if it means sitting with the patient and talking, and he feels much better, my job is done. That's called pain management as well. Pain management is not just electrotherapy or modalities or whatever. It's just, like you said, do the flossing. She feels better. Okay, can we come in now? Can we start strengthening your pelvic floor muscles? Can we start getting your stability? Yes, the pelvis is rotated, but how can I engage into actually rotating it and just getting that flexibility in, you know? Okay. So, you could do, so I do that. I do a little bit of strengthening exercises as well, a few bridges. I don't, although evidence is a little bit bleak on what modalities you can use on pregnant ladies, but I feel it's safe just to have hands-on rather than needling, electrotherapy. You can needle, but again...
Is cupping fine?
Again, where you're putting the cups, because there are acupuncture points in our body that could
yeah, so it's just
be safe. Yeah, be safe, you know. Okay. Again, the mom's going through a lot. The last thing I want her to think, oh my God, Pearl put a cup there, you know, I could have, you know, something could happen to my baby, you know. So yeah.
Okay. So we want to get into how is strength training, let's say lifting weights with the proper form and everything. So how does that help into curing that pain as well, other than the physiotherapy itself? So you have a job that's okay, you would release the knots, release the muscles, addressing the problem, diagnose and everything. And there's the part where you strengthen. Yeah. So that's why me and you, we've been working for such a long time together now. So I give you patients, you give me high. So it connects together. Yes. So strength training is going to make you better. Yes. So of course it depends on what
condition the
condition
has, exactly.
you have.
But that doesn't limit them. Exactly. Even if they have a condition, they can do strength training.
But I do understand it is frustrating for people when they have pain. They think that if I do train, it's gonna
get worse.
Triggered. Yeah. So let's talk about the importance of strength training in that terms.
Okay. Strength training itself is strengthening your muscles, whatever it might be, you know.
And whether you're pregnant,
whether you're not pregnant, if you're old, if you're going through menopause, you have to be strengthening your muscles. Any strength exercise, apart from actually getting your muscles activated, is just having a healthy lifestyle. It keeps you going. It keeps your body moving, and you know, you're just being. And
you're strengthening your muscles, which muscles can protect your joints.
Exactly.
That can thickens your bone density and all that.
All those things. And let's not forget that actual evidence shows that strengthening or physical activity prevents you from having comorbidities, prevents you from having illnesses. It's not going to cure your illness.
But it does.
But it does. And
so there are a lot of studies in that. Yeah, exactly. And even it cures. I don't know if that's the actual term for us. I don't want to say something wrong. But so people, when they have, like, let's say, hormonal issues. So exercise resistance regulates this, exactly. So people with having, let's say, like polycystic ovaries or the syndrome or any, it does regulate their like cycle and their hormones and. All that,
because you're exercising, and with polycystic ovaries, it could be many reasons, but one of it is related to the insulin in the body. Yeah. So if you're exercising, which we do say that, and there are campaigns that say, please exercise if you're diabetic, because it has shown to, not completely disappear your diabetes, but actually regulate, and if they're measuring every now and then, they'll see that, there is an actual drop, or,
there's a lot of studies
on that. Why is strength training important, apart from actually focusing on the muscles that are involved in to get to your day-to-day activities, or just overall muscle strengthening? It prevents you from having
these aches
and pains. These aches and pains. So for example, someone who's in a desk job, I know he's busy, I know he can't go to the gym, but I would advise him to go to the gym.
Try to make it happen.
You don't have to do CrossFit, you don't have to do weights, you do something that is going to help you strengthen. Strength does not only mean lifting weights.
Exactly. So resistance training is not just lifting weights, it could be body weight, it could be bands, it could be anything. And even if someone doesn't know, like never trained, so it doesn't mean you need to start with no, actually we don't do that. We correct the movements, so we know how to
improve the flexibility.
Exactly, like we said, we talked about the breathing and the core bracing and how to do that. Exactly. So we're not going to just come on do that without addressing how you move.
And apart from you strengthening your muscles and addressing the actual cause, scientifically speaking, exercise, strength training, whatever it is, releases endorphins. Endorphins are natural painkillers in the body.
Yes.
So those natural painkillers in the body reduce your pain. It's actually it's a proven fact. Increases your serotonin. That's the happy hormone that makes you feel good.
Yeah.
So someone who
they call it the runner's high or something.
Yes, exactly.
Yeah. So it does give you that
boost. These are proven facts. It's not coming out of just our mouths, but these are proven facts. So not only does it help you strengthen your muscles, but you actually make yourself feel good about it. So people who are depressed or anxious, what do they tell them? Just go out for a walk. So
it is very simple. So again, so training is not just about losing weight or building muscles. It's about strengthening. So the strength training is really underestimated. And like, why would I need strength? Like people would say, or let's say girls, and I'm not going to say all girls because I love all my girls that come and they do love strength training. And there are people that love, but it is important because you don't need to reach to that pain level and then say, now I need to strengthen. So you are doing that for not to get pain, to avoid pain. And let's say, I would give an example of me so I don't say anyone. So, okay, yes, I do train a lot and I do come to you on a regular basis. Yes. So it doesn't mean I am...
Something's wrong with you, no.
That's the thing. So we don't have to stress about when we go to a physiotherapist because for me, that's someone that trains, let's say, 3 or 5 days a week. I do need some kind of
release.
We
say, maintenance.
Exactly. And it is okay because because I'm not going to be perfect, obviously. Like, I have some issues with...
Anyone has issues. I was pregnant. I had sciatica. I had carpal tunnel. I had low back pain. I'm a physiotherapist. I knew I had every single thing.
So, it is okay. And I didn't wait until I get severe pain to see. So, what am I saying is a physiotherapist is not just when you have severe pain.
No.
So, if someone is training regularly, weights and doing stuff that would overload these kind of muscles, so you need to go see it.
And don't get me wrong, but again, I see athletes that are perfect. They know what muscles to strengthen and they come with pains and aches.
Which is normal.
Just address it so it doesn't get
to a chronic.
Because what happens when you have the pain, not only you know that you have the pain, but your body knows you have the pain. So what you do automatically is you compensate. You put the pressure or you put the load on other muscles.
And then it's a cycle. So this will get loaded and then this gets too much loaded, the other will get loaded. So,
but question to you.
Yeah.
Okay, so you were saying why is strength training very important? And I told you why it's important in a physiological aspect and scientific aspect. But do you think because I feel I have seen a change, people are understanding why it is important. But from your perspective, from down the line now, say 6 years, 7 years, if you're into this business, do you think people do understand why it's important, or they're just coming for the looks?
I would say it's a mixture of both.
Yeah.
Maybe we are still, let's say especially girls, they don't think strength is that important.
Yes.
They think, why would I need it?
Yeah.
Why would I need strength?
Yeah.
But it is not just about you taking the grocery bags, or it's just more about that, the way you feel. And the term of people saying, I want to tone up my body, or the toning
up.
What
does that mean?
It means you need to build muscles.
No, they mean I need my six-pack, I need to look slim.
I dislike this word because I don't know where it came from, because the toning up means you need to get muscles in your body. And then when the girl comes and tell me, I don't want muscles.
I don't look like a man.
But where did you get this idea of you don't want muscles? Because muscles is not just for a man. And it is for both. Yeah. And so again, the answer to your question, I do have both. Yeah. And I feel like it is out there, but I feel people want to get stronger. Yeah. But they're still afraid of weights, because the only way for you to get stronger is to lift weights
Yes.
and in the proper way. But they're still afraid of lifting heavy weights because it's still in the back of their mind, lifting weights will cause low back pain.
Yes.
And that's due to some specific sports,
Yeah.
some specific trainers that maybe they're not cueing
Yeah.
well enough
What they're doing, right?
what they're
Yeah.
doing. And so, yeah, it is. I feel like when we started COVID, so people got more aware
About
of
their fitness. Yeah.
fitness and health in general, but there are still a lot of people that's actually not training and not aware of how physical activity is actually important.
Yeah.
Yeah.
And for me to understand, okay, because I am sitting in my office and I get tons of patients that are coming from the gym with different problems. And it could be associated with what they did, but could be absolutely associated with something completely different. So if you get someone in your gym and say that the client is saying, I have severe low back pain and I can't lift weights today, what would be your approach? Would it be like, oh no, come on, let's do it?
No, I wouldn't do that. I would actually ask, okay, what happened? What
Okay.
did you do? How did that, can you describe the pain?
Yeah.
Is it like a sore? Because, okay, I don't know if you have those kind of patients, but because they come, sometimes they feel sore.
Yeah.
So some girls, they don't know how to differentiate between
Sore and
soreness
pain.
and pain.
Yeah.
And especially in the lower back.
Yeah, yeah.
Because sometimes they do work their lower back muscles and all
True.
that area. So they really don't know and they never experience the soreness in that.
Yeah.
So I need to address, okay, is it something that you bent over and got like let's say a spasm? And okay, if you feel like you don't want to do weights, relax. Okay, we'll do some stretches, we'll do some
Yes.
mobility
That's
work. We'll
excellent.
understand where is it coming from. Is it from the glutes or it's actually from the back? Or
Yeah.
in the end, I'm not a physiotherapist. I wouldn't diagnose,
Yeah, yeah.
but I
you
would
know.
understand if it's tightness,
Yeah.
if it stays for a week, 2,
Yeah.
3. Okay, I would recommend you seeing someone if the pain is still there.
Yeah.
But if, let's say, I would release her.
Yeah, because most of your clients that you do send me, they say, I did feel much better when she released me. So I think it's just muscle related.
Exactly.
But this is completely different. So that's why she sent me to you. So
Yeah, so if I did release her and she felt instant relief, so I would say, yes, okay, this is just related to muscle. I would ask her, did you drink water today? Just make sure you drink electrolytes, or let's say as simple as just water with just a pinch of Himalayan salt, because sometimes if you don't feel thirsty,
yeah.
your body is just needs that, electrolytes in
Yeah.
your body. So I think that's your phone.
Yeah.
Maybe maybe it's your baby.
Yeah. I'm sorry. Another question, because I also felt like a lot of the gym instructors, they are afraid to send their patients to physiotherapists. So maybe they think which we don't. I mean, I actually tell them what's the actual cause. But do you think it's because they think that we're going to say you did this in the gym?
I feel like their ego is like, oh my God, no, that's not me who did that to that.
Yeah.
Or let's say it's sometimes not related to you directly. Maybe, okay, you missed something, or that person did something slightly wrong in a second or a split second, or maybe she had something accumulating.
Yeah.
And when she did something, just overloaded and something bad happened. So I feel like personal trainers nowadays don't want to work with physiotherapists just because they don't want to have that. No, I know what I'm doing.
Yeah.
So don't tell me what to do.
Yeah, I think we should just work. It's great that we have this kind of dynamic that we work hand in hand. I can tell you what to work and that's what I want, to be honest.
Because in the end, I'm not a physiotherapist. I don't know how to diagnose someone, but based on my knowledge, I've worked with my experience, I would understand at least if someone has tightness and those pains from tightness and weakness, and I'm not going to diagnose. I say you have something. So I would say, no, I know someone that's good. Go check it out. If it's still, the pain is still there.
And vice versa. Like once I'm done with the treatment, as I said, in the end of the day, I'm a physiotherapist. I can advise you the exercises you can do, but I cannot sit and personally train you.
Yeah.
I will give you the exercises that you do, and I'll see if you're doing it right. But then I'll say thank you very much, because our job is to make sure that you have your pain is sorted out and you're fully functional. But to keep and maintain that, I think that this is why we have that dynamic where I can say, okay, Mona, please, can you focus on this?
So you do recommend all your patients to go train?
Yes. Not saying that they need to specifically go and do hardcore,
But I mean, in general, strength training.
whatever strengthening exercise is suitable for them. So if someone comes to me and says, no, I prefer that I want to do Pilates, okay, fine, that's what you want to do. You know, or if I want to do weights, yes, that's fine, you can do. This is what you need to do, but maintain it, because I shouldn't be saying this, but we fix the patient and we see them back after 6 months or 8 months or 9 months because they have not followed what we have told them, or they've not incorporated an exercise form.
Exactly. So that's why strength training is important.
Very important.
Exactly. So yes, I do know what you do is something big, but again, there are lots of aspects to finish up the job. So when someone comes with pain, you need to, you release those muscles, or you did what you need to do. And then there's another part, you need to strengthen that muscle so that pain doesn't come back again. So again, it varies from one condition to another. But in most cases, let's say, it is due to tightness and weakness, right?
Yeah.
So
tightness
and weakness. I'm just
It's related to the muscle imbalance. It's related to the stability wise. Yes, it's the whole package again. But I do agree that, and every paper that you pick up will say exercise worked for me.
Yeah.
So why go through, not do anything, get more conditions, go to operations, go do this, when exercise is the first non-invasive holistic approach, personalized. Why not? Yeah.
Mm-hmm. Okay. I remember once you told me that in the UK, so the physiotherapist is I don't know how to remember how you said it exactly,
first line of treatment.
Yeah. So and here in Bahrain, we need to see an
orthopedic doctor.
Yes.
Yeah.
So if someone has pain, what's the difference for me to go to a physiotherapist? When should I see a physiotherapist and when should I see an orthopedic doctor?
Yeah. So back in the UK, in the triage, there's always a physiotherapist if you have any musculoskeletal problem, anything related to the muscle, joints, bones. So if someone comes with the low back pain, they send it to the physiotherapist, and the physiotherapist needs to be efficient enough to identify if there are any red flags. When I say red flags, something that is alarming that needs to be referred to either the orthopedic doctor, neurologist, or anybody else.
Okay.
So you need to have those skills and the ability to do that. So when I went back to the UK, obviously I was not used to that form, because over here we get a prescription, we get whatever is needed, and then the doctor says do this and this and this. But I think that sort of training made me aware of what am I capable of? Because in the end of the day, we do study every single thing, every part of the body. We understand all the conditions, the diseases, everything. So we're not doctors. We are physical therapists. And when do you see an orthopedic doctor? When do you see a physiotherapist? This differs over here because we work under insurance. So all the insurance companies over here require an orthopedic referral. So even if someone comes to me and I say this and this is the problem, which again, I'm very confident of because of my training or where I've been, they still have to go to an orthopedic doctor because the doctor has to write them the report.
So in the UK, it's the other way around.
The UK is the other way around. So I will say, this person has low back pain. It's non-specific low back pain. This needs to be addressed. I refer her or him to the physiotherapy clinic, or no, I say that this is associated with a quad equina, which is actual nerve problem, and I have to send him to the neurologist or emergency. So here it's a debate or an argument back and forth with what the ortho said and what the physicians say. I think we need to work hand in hand because sometimes the orthopedics need to refer to the physiotherapist and sometimes we need to refer back to them. But that does not nullify or does not say that we don't know what we're doing. We are capable. We understand each and everything that doctor has written in the report. It can be correct. It can be wrong. It depends on your experience. But why is it different over here? Again, it takes a lot of time. It's not just here, by the way. It's the same in Italy.
Oh, so it's not just in the Gulf.
Not just in the Gulf. Okay. It's still there in Italy. I think in even parts of Asia as well. It's an evolving thing. And I think we might get there somewhere where we can say, okay, you trust that we are capable of doing this. But I think it's quite
Yeah. Okay. Is there anything you want to add? Anything that we haven't talked about?
I think we covered a lot of topics and quite interesting. I think we went through every single thing. But I think bottom line is it's great to have podcasts because it's easy for people to listen and to understand what we're talking about. And we've covered a lot of aspects. What I would want to say is that whether you're a woman or a man or a child or whatever it is, whoever you are, you need to focus on your own health. You need to understand what you're capable of doing and what you aren't capable of doing. You have gone maybe 30 years without doing exercise, but everyone has pain and aches. Even the strongest person in the world will have pain and aches. So address it. Understand why is it there. Go to the concerned person, whether that's a doctor, a physiotherapist, or a trainer, and strengthen, because exercise...
And educate yourself. Educate yourself. It's really important to knowing what is this...
What is actually happening, because why restore to taking a pill and, fixing yourself when you can stay healthy and prevent other things, other conditions when you're just exercising.
That's great.
Yeah.
It was so lovely having this talk.
Thank you.
It feels like feels like when we have our sessions.
We're just talking about a lot of things. I think we went over the time or something.
I think we'll continue this tomorrow when I see you.
Yeah, yes, definitely we shall. But no, thank you so much.
Thank you so much for coming. Well, I know you have a baby
to attend to. Yes.
Yeah, so thank you again for taking the time to come.
You're most welcome.
I hope everyone was interested to listen to our topic and take any kind of action if they're going through any specific things.
And thank you so much for building the bridge, I think, between physiotherapists and personal trainers. I don't think we need to fight each other. And I like that we have this ongoing communication that, we can help one another. So thank you.
It was so random how I met you, actually. Yes. So I was glad that I got to meet you.
Likewise.
So thank you so much.
Pleasure. Thank you.
You.
Take care.
Bye-bye.
Bye.